Hi, I am Dr. Pankaj Gupta from Access Health Digital. We are a not for profit think tank headquartered in the US and we work in multiple countries. So, healthcare has undergone a tremendous change, especially because of the technology coming in. But the first wave of technology that came in, a lot of investment came in from outside India. There were standards that were put in place by Government of India in terms of the EHR standards, and then the metadata data standards for health, and many other things that happened from the government's perspective in terms of enabling it, and also the private sector put in a lot of investment into the market. But the adoption sort of suffered because of two reasons. One is there wasn't a very strong governance, and the second thing is that there was the financial lever was lacking. So unless there is a financial lever that leads to the change doesn't happen. And in this particular case, in the last 5 years, the adoption has been sort of lesser than what you would want. And these were beautiful books that were on the shelves in terms of standards, but they didn't get adopted. But now, what has happened is in the last couple of years, I would say 2 years or so, so the National Health Policy came out in 2017, and then the universal health coverage was announced by the Government of India, and that became a financial lever to bring in the change. And in the last 1 year, there's been plethora of activities in terms of bringing that change together. Ayushman Bharat has happened, and the market is seeing that without the digital, things are not going to be possible to sort of work on, and a lot of adoption of the new age technology is beginning to happen in healthcare on the provider side as well as on the payer side. So the change that I want to bring in healthcare is obviously going to be the grounds up development from primary healthcare in terms of healthcare capacity building, using technology, using digital health. Now that the financial lever is in place, which is the Ayushman Bharat, and that is going to lead to the maturity of the health insurance market. And because of the health insurance, the providers will fall in line in terms of standards, in terms of so once the standards are there, the semantic interoperability is there, all the systems can talk to each other from primary care all the way to secondary and tertiary. And also to support it, what we will need is a whole lot of capacity building. So we need people. There are sort of reports that say that you will need at least 11 lakh people to support this huge change which is coming. And that you again cannot sort of train so many people physically. It will have to be a digital platform to do that. And also to deliver this change in the market, it will have to be a digital platform that will carry the claims from the provider side to the health insurance, and it will have to be auto adjudicated. Only then this huge change will come in. And the size of the change is so large that it cannot be handled without digital. So you will need to have a platform approach rather than a systems approach. And the platform will have to be a ubiquitous platform where all the providers and the payers can log in. And healthcare finally sort of gets a digital health platform. Digital health is powering the future of healthcare. That's what I would say is the punchline in terms of what we really believe. VOH actually plays a vital role because it is addressing that segment of population where the majority of the providers are focused. If you look at India, about 90% of the providers are between 0 to 10 beds. Between 10 to about 150 beds is another 5 to 7%. And VOH is focused on this segment, and definitely it will have an impact because this is the segment that is going to become very large as the universal health coverage begins to grow. Thank you.